Thank you. Another question that I want to address, it was actually asked in the first session, but we didn't have time to go through the session. So, um, our discussions about targeted therapy and resistance is a moot point if we do not perform the molecular testing. And the question that I have is, what, in your opinion, are the biggest barriers to the widespread adoption of comprehensive molecular testing in lung cancer? And taking into account that we are talking to patients, what can patients do to make sure that molecular testing is performed on their tissue? Anybody?
I can start on this one. So there are a number of barriers. The first is that the tissue that we get from a biopsy may not be enough for molecular testing. And some places are not sending both a liquid biopsy and tissue molecular testing because they're worried about insurance not covering both tests. So while that's ideal to be able to send both of those at the same time so that you can try to get an answer in a timely fashion, that's not always possible in all scenarios. The next barrier is that there actually are a number of options for where to send the molecular test and how to send it. And for people that treat a variety of cancers other than lung cancer, it can be kind of confusing about which is actually a comprehensive test. So we have there are too many options, and the education around which options are adequate is still lacking. The next barrier I would say is at the beginning of diagnosis, there's a lot going on, right? So patients are having symptoms, you're getting scans, and the provider has to think to send the molecular test. They actually have to physically send the test, sometimes fill out the form, and that can be there can be a delay because of that amount of time that needs to happen. So I think what patients can do is they can ask about their molecular testing. So they can ask to see the report. They can say what kind of molecular testing was done. Was it done on my tissue and the blood? Could we do both if something wasn't found on the one that was sent? It's a tricky situation. Thankfully, it's getting better. It is getting quite a bit better, but I think patients can ask that question of their care team.
Any other recommendations for our patients?
Yeah, I think you did an excellent job summarizing it. The International Association for Study of Lung Cancer, ISLAC, actually just put out a biomarker survey trying to understand why isn't every patient with non-small cell lung cancer getting molecular profiling. That is a huge call to action. It needs to happen. If it can't happen from the provider level, patients need to ask. Their loved ones need to ask. If you have non-small cell lung cancer, did I get molecular testing? It's also called biomarker testing. There's a lot of different names for it, but ask. And the other thing I'll just add on to what Melina said very nicely is it doesn't even matter what type of non-small cell lung cancer you have. I know in NCCN guidelines, they say non-squamous, it's recommended and you need to do it. In squamous, it says consider. No, I tell every fellow that comes into my clinic, even if you have squamous non-small cell lung cancer, you need to ask for molecular testing because I can't tell you the number of times I found an EGFR mutation. What if it's a combined histology, not just squamous, but adeno, and the piece of the biopsy just captured the squamous and you missed the adenocarcinoma? So get that testing.
And then the last thing I'll add to what Eric said is that if everybody views imaging as critically important to decision making, you have to view molecular testing at the same level as imaging and understand the inconvenience, but it's equally necessary in terms of the right treatment decision making.